Hello, I'm Dr. Henele, and I'm here to talk with you about release point therapy and some of the techniques we use in the system. One of the techniques that we use, and it's really a main technique that we use, is called superficial fascial expansion. And we have several techniques under this genre, but as you come in a little bit closer, I want you to see one of the first focal ones we teach in the program, called the fascial hold. One of the big hallmarks of this system is that we create space. We work in a way that starts to break down scar tissue in the soft tissues of the body so that we can have more space in the somatic volume of the body and thereby allowing muscles underneath to kind of relax. Now, one of the ways we do that is by always paying close attention to the parasympathetic nervous system and especially our client's breath. So if you can see this, if I have a good application on a hold, you can notice that there's great movement in the low back. Now this is all done, almost. I almost have the right hold for this client's body. Let's see if I can find a new spot here. There we go. There we go. And you see how that breath expands right there? That's all done because with this hold, with the fascial hold, I have it at the right amount of lift away from there. If I lift too much, the breath shuts down. If I don't lift enough, the breath never engages. So it's a very important skill to develop as a therapist to learn that exact location. And that skill is learned by always watching the breath. But let me show you how we start with this hold. With this hold, as a practitioner, you start by making a triangle with your hands. Then you take your fingers a little bit apart because you need to give some width for a future technique called fascial walking. But as the hold is maintained, lay your hands flat. Press your thumbs into the tissue, draw the tissue back between the forefinger, right here on the knuckle, and the thumb. And what you'll see with that is a great hold has these dynamics. The hand is relaxed. The three fingers over here are assisting the hold by bringing tissue from other areas closer into the vicinity. The thumb and the forefinger act like a clasp, and you can see how strong that muscle is in this technique. That's a muscle that we have to build up for practitioners in this system. But what we see here is the hand is relaxed. There's no tension and force. Now, in watching this hold, what I want you to see here also is that we have palm to skin contact underneath, and it's kind of hard to see in screen, but what you notice is that the skin is contacting the web here. And what that allows us to do is to establish an energetic connection as we're also working structurally with our client. Now finally, the last dynamic that we like to have is to drop the heel of the hand down. Much like, let me hold this here, much like we're doing this. Look at the thumb. What happens is we get a nice lift that really feels great to the client. It's easy on the practitioner's hand when it's practiced correctly. And a key ingredient to our system is with all techniques, it's done without force. We have very few rules in the system. One of them, though, is if you practice with force, you're doing it wrong. Body work, as it's done for transformation, for healing injuries, for getting scar tissue out, for helping to alleviate pain syndromes, should be done without force. And when you practice without force, you get such great results. And clients tend to love what you're doing, so they tell other people. So, in a nutshell, that's the fascial hold. Great dynamics, great lift, and as always within this system we are searching for, in the pursuit of creating space, great breath.